We're going to be placing a bone replacement graft on tooth number 18 using the Collagen Matrix Dental Socket Repair Kit. It comes with one Synos putty, one Matrix Derm Extend, which is a porcine collagen, and one polyglycolic acid suture 4.0. Let's open it up. First take out the putty. That's the 1C Synos putty. This is the collagen membrane, the Extend, and the 4.0 polyglycolic suture. Okay, we're opening up the Synos putty, 1cc. Opening up the putty, you can see it. What I'd like to do is hydrate with a little local anesthetic. You can use saline or local anesthetic. And we let it sit for at least 1 minute. We'll take out the porcelain membrane, or the porcine collagen membrane, open it, and let it soak also in saline for approximately 1 minute or longer, just so there's some malleability and also retention of the rigidity. Take this out and we'll drop that into saline. Alright, we've let the collagen membrane hydrate for approximately 1 minute. Now we're going to take it back to the site and place it. I'm just going to slightly trim the membrane so that we can place it under the flap so it doesn't bunch, and fit it to the site. Turn to your right. We're placing the membrane on the lingual aspect of socket number 18. We created a slight pouch for its placement. Now we're going to come back and place the Synos putty into the socket. Turn to the right, sir. Thank you. So nicely it molds into place and packs nicely into the socket. Section right there, that's slightly. Thank you. We'll take the membrane, following a little picture. Take the membrane, bring it over to the facial surface, lightly pack that underneath our pouch, and we're ready for suturing. Stay open, please. We'll now take our 4.0 polyglycolic suture and in a figure 8 fashion close up the socket, or at least get coverage over the membrane. The membrane is suturable as well. In some instances, if you want to or you need to have stability, you can suture through without any ill effects. I'm going to come through the facial. And we'll place another, pass the suture through the lingual. Now tie it off. And we'll place one more suture on the distal aspect. The drop pin has a little itch. As you can notice, we're not getting primary closure, but with this membrane, we're able to leave it exposed to the oral cavity. Patient will be placed on a chlorhexidine rinse, and there should be no ill effects with healing. We're going to take a photo. And we've completed the procedure.